Now we'll be discussing about killer diseases in children because most children die out of neglect and what would I say, and ignorance. Many mothers lose their child, and that is why immunization is very necessary. So, nurse, you'll be telling us more about killer diseases that also occur in children from ages from week 1 to a year.
Okay, that question is vast. If I start to call it, say it one by one, maybe I'll just name it and then pick one to discuss. Because killer diseases in children, that's why we give, what do you call it, immunization. This immunization prevents 6 killer diseases first. 1, this cough. 2, measles. 3, polio. This thinning of the leg. 4, diarrhea and vomiting. Fever. These things occur in childhood. Then some parents are ignorant of these things. A child will be having fever at night. In the morning, the child will be okay and be playing. Parents will not know. They will not be observant of their babies to know that when the baby has had fever this night, tomorrow night, that it reduces blood, that the fever breaks down the blood cells so fast that before they think of going to hospital, the baby has lost a lot of blood. The baby will be brought to the hospital, paper white. Before you look for blood to transfuse, the child is gone. So, but I want to concentrate on diarrhea and vomiting, which is another killer disease in children. Some parents will say that their baby is vomiting. It is due to teething. The child is bringing out
New teeth.
teeth. Therefore, that it
is
will
normal.
stop. It is normal. Some children will be having diarrhea. They will not take the children for treatment to the hospital to assess treatment for the child. They will say it's because it's teething. This is one of the reasons diarrhea and vomiting kills these babies, because before they now move to look for treatment for the babies, they will already be very weak. You might not see the vein again to set up infusion, drip. You might not be able to, the child might not even have blood again in the body, making the child to die quicker. So my advice to women is, once your child has fever today, you give paracetamol and it did not stop, tomorrow take the child to the hospital to assess treatment. Diarrhea and vomiting kills children just like this. It does not play with children's health at all. So it's not something that should start in the morning till evening without a mother carrying the child to the hospital to assess treatment.
So, nurse, what causes this vomiting and diarrhea?
1, death. Once children start crawling, they pick anything and put it in their mouth. It is natural. So you don't know what they pick. You are not always there to see them. So once a child vomits, your mind will say, oh, what has this child taken? So with that, you go for treatment so that they will give, one of the treatments will be to give the child an antidote, something that will neutralize anything, whatever the child has ingested that is not good in his body. One of the causes of vomiting, the child will have developed worm. If the child is up to 6 months, you start thinking about worm infestation. You deworm the child. Then diarrhea is also caused by death, injection of the death into the mouth, because children are very exposed to any type of illness once they start crawling, walking at that early stage. That is why mothers are advised to always be careful of where they leave their children. Observe the children where they play. That is why it is advisable for those who can afford it to have an empty room which is always kept clean for the child to be playing in there, because the child still needs freedom to play and move about. So diarrhea and vomiting is a serious illness in babies.
I heard you telling one woman the other day that she should be mindful of how she keeps the cups, spoons, and plates.
Yes. Sometimes the things we feed the children with also causes diarrhea and vomiting to them, because while we stopped feeding bottle on babies, some women will leave the feeding bottle on the floor, outside, in the kitchen, anywhere, and flies will be licking the teeth. And once these women come home from anywhere, the child is crying of hunger, they will go and pick it, clean it on their dirty wrapper that is so dirty with dirt and sweat, and put the feeding bottle in the mouth of the baby. By so doing, is introduce dirt. These are the causes of dirt, injection of dirt into their stomach. They stopped. We advise on exclusive breastfeeding. It's because of we're looking for where or how to reduce this diarrhea and vomiting. That's why we advise women to stop cup and spoon, stop feeding bottle, only breast. Yet you see some women, they will come home from the farm, instead of washing their breast before feeding the child, they will just use hand to clean and put the breast filled with sweat and dust into the mouth of the baby. So the general advice to women is to always be clean. As long as you feed your child, everything you use for feeding that child must be kept clean. You use cup and spoon, wash it, and have a container where you emerge those things that the baby is using, and you add Milton or what do you call jig, not jig, the other one that came out newly, hypo. You put a drop in it. That's how you preserve whatever you use for your baby, either cup and spoon, feeding bottles.
The mothers will be very careful to rinse it very well before they use it again. So
yes.
Since you add
when you merge it inside that container, anytime you want to use any of those things, you rewash it with clean water before using. Also, for women that have house helps, you observe how the house help feed your babies before you know how dangerous the child is exposed.
Okay.
Thank you.
This is a very interesting topic. We've all heard it. Vomiting and diarrhea. Many people lose their loved one, their children, their babies to this killer disease, vomiting and diarrhea. It's out of ignorance. So we've all heard it now. She has told us the causes and the preventive measures to take to curb it. So it's left for us to embrace this knowledge.